We implemented some strategies and some protocols pretty early on.
Yeah, prior to having a mandatory COVID-safe plan.
Back in March, we got our staff together and said, look, we don't know where this is going, but we feel that we need to implement these procedures to help manage whatever it is to be, I guess, because we really didn't know how bad it was at that stage. So that was one thing, like getting them on board early on to understand the seriousness, I guess, of the situation. And that was one way we managed it. The second way, I guess, was we've got pretty good relationships with the medical centres around the area and the nursing homes. So we were able to sort of be aware, I guess, of what was actually going on. So when there were outbreaks, we kind of had a procedure that we were able to follow. What we found with
doing our Websters, if we were just wearing our masks and wearing gloves, that's what we were doing sort of individually for each different Webster. I think that was sufficient really that's all we really needed to do from a COVID safe point of view, and changing our gloves between each Webster pack. And we've been able to maintain that. But deliveries have been, because when you're on site delivering, that's really the hardest. And we've even had to do that with customers that always tell us they're COVID positive. Our customers are really good. They'll ring up and say, we're COVID positive, we need a delivery. Don't just come drop it at the front door. But then there's that whole issue of our from the moment you open their gate, ring their doorbell or whatever, we've got to be able to make sure our delivery staff are wearing their gloves, or some of them prefer not to wear gloves, they prefer to sanitise. So it's really an individual thing, as long as they're doing one of those procedures. We do have our signage though, and our warnings, all over this front of the store. We've had one person, I think, that had been tested, but they actually stopped at the door, and they didn't actually come in and asked that we, bring out the medication that they were requesting. So the signage is working, which is great. Yeah, so we offer reusable or disposable masks. When they became mandatory, obviously we wore them every day, and we actually request that all our customers also wear them. So we actually offer a mask to somebody who's forgotten theirs or doesn't have one. We also applied for the free masks that the Department of Health and Human Services was providing for our vulnerable customers who perhaps couldn't afford or weren't able to access masks. So look, we've been right behind it because, we see the value in it, in preventing infection. So, we've been very supportive of it. As challenging as it is, wearing it all day, I think it's necessary at this point till we get our numbers down. It's been a bit of a challenge with some of our migrant customers who don't quite understand or what the requirements are. So we've had to sort of explain to them why it's important to do it right now. And, they've been pretty good once you explain it to them and help them to understand why these restrictions have been put in place. I think that's the issue, the vulnerable people. One would be our pharmacotherapy clients, because they're just not religious with doing it, and having those free masks from the government that we've been able to give them has been fantastic. But definitely the migrants, they don't always get the message, they don't always understand. So we speak Greek, we have a very large Greek population, and that's proven to be really, really good for us to be able to explain it in Greek.
We're very passionate about what we do.
Yes,
I think it's the fact that we are doing something that is a benefit to the community. And we see, I guess, positive outcomes. It reinforces that what we're doing is having a positive effect. So I guess that's our motivator to just get up and keep going.
Yeah, I think our community is very loyal, and we have received so much recognition from our community.
Yeah.
Cakes, flowers, cards. We've kept all our cards of people that will just write how we've helped them during this time, which is so wonderful.
And some of it's just like, thank you for being open.
Yeah, and we open on Sundays. We never ever opened on Sundays We were always very protective about our Sundays. So I think when you get that right, that recognition, and people really appreciate what you're doing for them, it's an easy thing to do.